Hi, I'm going to count down. 5, 4, 3, 2, 1. Hi, everybody. My name is Carmen Cawthon. This is Advocacy in Action, Navigating the Healthcare System. I just want to welcome you here. Thank you for joining the group, and thank you for joining me today. My goal will be to do lives on Tuesdays and Thursdays at noon, and we'll talk about different things. I'm going to wait just a second and see if we build the audience a little bit. So I'm going to go ahead and get started. So again, my name is Carmen Cawthon, or Carmen Wimberly Cawthon, for those of you who've known me for a long time. You know I love my Wimberly name. Thank you for joining us. I want to talk about advocacy in action, navigating the healthcare system, and today we're going to talk about the paperwork that you need in your pocket to navigate the healthcare system. First of all, let me tell you a little bit about how I got here. Part of my training and purpose in life is to take care of and to advocate for other people. I grew up as a community activist child, and even when I was in college and as a working mom, I was bending over backwards, taking care of everybody else. After losing a child to violence, being diagnosed with a rare disease, and on oxygen 24/7, caring for a sick child and a husband, I found myself extremely depressed, and I made the decision to come home from work for 6 months. I ended up not ever going back to work. In the process, I then helped take care of 2 elderly parents, both of whom have passed. After about 50 years of living numb and leaving work, I started to travel around the world. I started a business using the skills that I've been developing all of my life. I'm speaking up about race, equity in the community, and now I get to hang out with people who are changing the world. So those are the things that I love doing. So, talking about the paperwork that is needed, whether you are a patient or a caregiver, there are tools that you need to have in your wallet or your purse or your phone at all times. And this is a list of what they are. The patient's legal name, not their nickname, their date of birth, their social security number, insurance information, a medication list, and sometimes you need the bag of medicine. That's what the doctor tells you to bring. A diagnosis list. And for people who have chronic illnesses, which are illnesses that are ongoing all the time, and you really have to keep up with them, not a cold or sinus allergy or something like that. You need a composition book or some type of notepad so you can take notes when you go to the doctor or the hospital or any of those kinds of places. So if you have had a chance to look in the file section of this group, you'll notice that I put some documents in there. Each document is in Word format or in PDF format, and if you need it, if you don't have access to print those documents, if you will put a note in the comments section, I will create just a picture, a JPEG, so that you can at least populate it on your phone. Each document also has a direction sheet. So if it says medication schedule, it says medication schedule directions. And if you have questions as we go along, then please put those in the comments section, and I'll try to answer them here. And if I can't answer them here, then I will do a separate document or a comment or post answering the questions that we got today. Okay, let's see, where are we going? And the other thing is, even if you can't download or print these documents out, these all started on a piece of paper in a composition book. So please don't let the fact that there's some technology here scare you or fool you. I love a composition book, either the spiral bound or the ones that, that we used to have to write in when I was a child, and kids still have to write in them because they're bound and they're easy for me to put notes in and keep up with things. So you don't have to color code these documents like I've done them, but it is helpful. If you don't have highlighters to work with, you've probably got kids or grandkids around that do. Borrow them. The doctors, especially for the medication schedule, doctors and nurses have always been really impressed with the fact that I have color coded the sheets, because it's easier for you to look at something that is a different color and figure out what you're doing. Make sure you're doing things right. So I'm going to start with the medication schedule and just go through it section by section. So on the medication schedule, it starts out with the person's name, the fact that it's a medication schedule, and it says as of and has a date. So if you are like me, if you get better or you get worse, the doctor changes your medicine. And so every time I have a medication change, I make sure, or my patient has a medication change, I make sure that I go in and I update the medication on the list. And at the top, I put what date the medication was changed. That's really important, because when you're in a crisis or you're in a hurry, you don't want to have to think about what date you changed something. The next line says primary care physician. Everybody generally has one. If you go to a doctor, if you go to a clinic, if you go to the urgent care is your primary care, if you have a doctor, put that there. Put their name there and put their contact number, telephone number. If you have other physicians, if you have specialists, I put those under other. I put their name and their phone number and what kind of doctor they are. If you don't remember, they're a cardiologist or a rheumatologist or those kinds of things, just put heart doctor or arthritis doctor or, whatever kind of doctor you call them. So, when you're looking at that, or the person who's the patient knows what it is. We don't all use the same terminology, but you want to be able to identify who those people are. If you'll notice, the next lines are in red on the sheet. The first line is drug allergies. Those are in red because they're important things that you need to know. If you're allergic to penicillin, if you've taken a medication and you had a reaction to it and the doctor said, don't take that anymore, put it down as an allergy, because you don't want somebody to mistakenly, in a crisis, give you a medication that you had a reaction to and you have the same or worse reaction. The only thing I know for me is that I'm allergic to penicillin. My mama said I took it when I was an infant and I had a rash and a fever. So I don't take penicillin. And that was 60 years ago, and she's not here to tell me anything else. But I know I'm not taking any penicillin. The line under drug allergies talks about other important information that you may need, or a medical technician may need to deal with whatever you're going through. If you're a person who has asthma, and when you have an asthma attack, you need to use your medication, your inhaler, quickly. What I put on the sheet is, when having an asthma attack, use 2 puffs of albuterol inhaler immediately. You might not have time to go through your list of medications and figure out what you're supposed to do next. So that's why you want the important stuff up there on top. I was diagnosed with pulmonary hypertension. And so that means that the artery going from my heart to my lungs was constricted. So I wasn't allowed to drink a lot of fluid or to have a lot of fluid intake. So that's what the next direction says: no more than 2 liters of fluid intake daily. And if I had a weight gain of more than 5 pounds in a week, I was to call the doctor, because that meant I was retaining fluid and that was going to make it hard for me to breathe. Okay, let's go on to the drug list itself. So on the top line, you see it says drug name. The reason for taking it is underneath there. And then the next block is NO period, number of tablets, capsules, or drops. Then the prescribing MD, that's the prescribing medical doctor, or just the doctor's name. The dates taken from and to. And then you'll see color-coded AM, lunch, dinner, and PM. And if you are wondering why I'm looking down, I'm looking at the list because I want to be sure that I don't skip anything when I'm talking to you. So on your direction sheet, you have, I have 2 different medications, and I've put on the sheet how I would put them on the sheet. You do the best you can. Most of this information you can find on your prescription bottle. It will tell you, you get the name and the dosage of the medication. So for the first one, it says Celexa 40 milligram. So that is, that will be on your prescription bottle label. Underneath that, it says mild depression, because that's what I would be taking the medication for. And then in the next block, it says 1 tab. So I'm taking 1 tablet. Dr. Jackson is my primary care physician listed on top, and that's who prescribed the medication. And I've been taking it since 2010 to the present. If I stop taking a medication, I put the date on there that I stopped, and for probably the next 4 or 5 months, I will leave that on this list, and then I take it off after a while because I don't necessarily need to keep up with the fact that I was taking it. And so if you look in the color-coded section under AM, there's an X, because I'm going to take that 1 tablet of Celexa in the AM. You will need to ask your doctor or your pharmacist if it's best to take the medication with a meal, before a meal, 20 minutes after a meal, if it's 12 hours between AM and PM, if it's 8, 2, and 8, that helps you figure out where in these color-coded spots to put your X. If you look at the second medication, which is hydrochlorothiazide, the strength is 25 milligrams. You take 1 tab. Dr. Jameson prescribed that. He might be a heart doctor, or he might be, a different kind of doctor. So I started taking that medication in 2019 to the present, and I take it 3 times a day. Probably not, but that's what I put on here. So I'm taking it in the morning, at lunch, and at dinner. That might mean that I need to, for lunchtime, I might need to spread that time out. And I might need to write under there instead of lunch, because a lot of people eat lunch at 12. So I might need to put, if I take the AM medicine at 8, I might need to change that to 2 o'clock. And I would just need to write that in the parentheses somewhere so that you know that you're taking your medicine at the right time. Sometimes the doctors don't necessarily tell us these things, but we get to ask questions because we're paying for their time, and they're supposed to make sure that we know the things we need to know. But sometimes they get hurried because they're human beings, and so we have to ask, and it's okay to ask. Okay? All right. So on your, you do that for as much medication as you take. If the doctor tells you to take acetaminophen or Tylenol when needed for pain, put that on the list. That's still a regular medication for you. If you have some pain, PRN is what they will write sometimes, is if needed. Put that on your list because they need to know that you take it, even if you only take it sometime. I have a patch that I take for pain, that I use for pain. It's a prescription medicine. I don't take it very often, but you can best believe if it's about to rain and I've got some scar tissue that hurts, I take it. But the doctors all need to know that that medication might be in my system. Underneath this chart, also in red, says oxygen, 2 liters, who prescribed it, the name of the doctor's office, their contact information, and it says may leave space for MD signature. When I was originally diagnosed with pulmonary hypertension, I was placed on 2 liters of oxygen, 24 hours a day, 7 days a week. I didn't come off of it for several years. And I put it, and then I left the space. And when I was at the doctor's office, I had my doctor to sign that. You don't have to do that, but sometimes people don't know what liter usage you use. Your liter usage is not going to be what somebody else's is. You might be on 2 liters continuous pulse, or continuous flow, or you might be on 3 liters. You might only have to use your oxygen during the day, or you might have to use it 24 hours a day. And you might even, I have sleep apnea. So I had oxygen and my BiPAP machine. So when I would go to bed at night, I would take the oxygen off of my face, hook it into my BiPAP machine, and put that mask on and wear oxygen all night while I slept. So that's information that's important for you to put on here. If you use a CPAP or a BiPAP, if you have something that regulates your insulin that's attached to your body, if you have medication of another kind that's infused into your body, all that information is important to put on here for someone to know in case of an emergency. Okay? This does look like a lot of information, and it's not hard to pull together. It just is a little time consuming. If you take an evening and just go through all of your medications and do that, you should be able to get this done in less than an hour. And then if you can go to the copy shop, if you need to, if you can print out copies, if you live by yourself, I have relatives who live on their own. I suggest that they have a copy of this on their refrigerator, that they have a copy of it on the back of their front door, so that if something happens and they have to be taken out with emergency personnel, the personnel will see that if the person is not conscious or not able to tell all of their own information. I have a copy of it in my purse. I have a copy of it for my kids. So they have their own, those that are on, if they're on medicine, they have a copy of their medication list and all this information. When my parents were alive, I made sure that my mama had one in her wallet. My father had one in his wallet. He just passed a couple of weeks ago. And yesterday I was going through his wallet and, cutting up things. And I found his list. It was an old list. It was creased. It was folded, but it was there. So if something had happened to him and first responders had, looked for, or if he had gone to the doctor's office or if he had gone to the pharmacy and somebody asked him a question, if he didn't remember everything, he could pull out his list and say, this is what I'm taking. Even sometimes if you have someone in your family who's got high blood pressure or diabetes, and you go to the drugstore and you say, you ask the pharmacist, okay, I'm getting this medication. I'm getting medication for someone who has a cold or the sniffles. Can they take this with their other medication? And you can pop that list up and share that with the pharmacist, and they can tell you, I'm reading on the back of the ingredients. Yes, they can take this, or no, they shouldn't have this because there could be an issue. So you want to be sure that you have this. And especially if you have someone who has a chronic illness, if you have a child who has asthma and you have to take them to the hospital for treatments sometimes in the middle of the night, the last thing you want to have to think about is, where's this? How do I pull all this together? You have it right there with you. And it is a wonderful tool, and I'm so happy that I took somebody else's and reworked it to make it work for people. Okay, so the next document that I'm going to talk about is the diagnosis sheet. When I first started taking care of my mother, and believe me, my mom was really, really independent until the day she died. And so she didn't like for me to know about a lot of her information, but the day she finally said, will you come go with me to the doctor? Or she asked me to take her to the doctor because she wasn't driving and daddy wasn't feeling good. And I went to the doctor with her, and we sat in the doctor's office. The first time we checked out of the doctor's office, and I took her sheet, and I was like, oh my gosh, I didn't know you had all this stuff wrong with you. She had pneumonia at the time and she wasn't feeling good. So I took the list and I kind of went through it, and I was amazed at the number of diagnoses that she had, because she was, going and doing all the time. It's important for you to know what diagnosis that people have. Some people will say, I've got sugar diabetes. Okay, that's fine. Do you have type 1 or type 2? Type 2 means your body's still able to make some insulin. Type 1 means you aren't making any insulin at all. So there's a difference in things, and how things are treated are differently. And the more information you know about yourself or the people that you're taking care of, the better questions you can ask when you're in the presence of medical personnel, and the better you can answer when you're in the presence of medical personnel. So on this particular list, you'll see this person has a lot of things going on. Coronary artery disease, high blood pressure, diabetes, anemia, gouty arthritis, COPD, pulmonary embolism, pulmonary hypertension, tricuspid regurgitation, partial deep vein thrombosis, diabetic neuropathy, glaucoma, cataracts, retinal issues, osteoporosis, and kidney function issues. All of these things were diagnoses. They actually had more things on their diagnosis sheet. Sometimes you'll get a sheet when you check out from the doctor's office, and if you ever have to go to the hospital, whether you're in the ER or whether you are admitted, when you are discharged, your discharge sheet will have a list of all your medications that they should have confirmed with you while you were there, and a list of diagnoses. Sometimes these diagnoses are what they think is going on with you based on symptoms. When I saw my mother's diagnosis list, the next time we went to a doctor, and he was a specialist, I said, I noticed that you have put this on her diagnosis list. Has she been tested for this? Is this a confirmed diagnosis? You want to be sure that things are confirmed. Sometimes things happen, and they are confirmed, and then the person gets over that. So that can come off the list. It can maybe go on a list of things that they have had, but you don't want it to always stay on the list if it's not something that they have anymore. I think if you'll look where it says pulmonary embolism, and that's kind of in the middle of that list, it says March 2010. It was not chronic as of December 2011, and the doctor's name is out to the side. That means that there was a change in the diagnosis. They still watch for it, but if it's not chronic, they probably don't have to treat it like they used to treat it. That is, that's really important. Sometimes, that's important for you, and that's important for a doctor. And that's important for their office, because sometimes they don't go back in and take it out. But if it was chronic at some point, you need to know that it was there, because it could ostensibly pop back up. If you look down underneath cataracts, it's vitreoretinal issues. This person went to the eye doctor one day because her eye wasn't feeling good, and found out that her retina was trying to detach. That is something that happens quickly, and We were fortunate that it was found, but while it was an issue, I put to the side that the right retina was reattached and the date that it was reattached. So that's some additional information for you to have. If you'll notice on all of these documents, things that I put in red are important things to keep up with. Because a lot of times when we are in the midst of something, we don't think about what has happened in the past, and we can't remember dates. We can't remember that kind of information. If you put it here, it's here. You don't have to think about it. So the next section is the surgeries. You'll notice also that I always put as of the latest date, because you want to keep the date information updated on all of your documents. Okay, so they had back surgery, the date that they had the surgery, and the reason that they had the surgery, if there was a reason. It could have been back surgery because of a certain kind of condition. It could have been back surgery because they had been in a car accident. That's what you want to put that information. The next section is medical and psychiatric illnesses and family connection. If you'll notice, as you're going into the doctor's office now, or even in the hospital, the ER, they give you a document and they want to know, did any of your family members have XYZ? This means you got to talk to your elders sometimes. This means you got to dig in your memory bank. And sometimes you just need to sit and think, or call a family member and say, okay, did anybody in our family have cancer? You want to go back, I would say at least one generation deep. So and you want to know if it's on your mother's side, which is maternal, or on your father's side, which is paternal. So maybe your mother and two of her sisters had breast cancer. Maybe your father had heart disease. You might want to just take a sheet of paper and say cancer, and then say, did so-and-so had this. This is my uncle on my father's side. You might have to stretch it out and then, make a comprehensive list. Did anybody in my family have diabetes? Or does anybody in my family have diabetes? Does anybody have high blood pressure? Do I remember whether or not anybody had any kind of mental illness in the family? And I want you to be careful with this one, because in a lot of cases, especially before our generation, people, in fact, let me just say back to the 80s, people don't like to talk about mental illness or psychiatric issues, but sometimes it's important for you to know that, because it helps those people who are going forward. It's not just legacy information, it is medical history information, and it can help you and your family be well taken care of. Okay, so the other thing you need to know is that the more you know, the better off you are. And sometimes people will not go back and tell you things, and you just have to accept that. But as much as you can find out, if grandma can't remember, or if grandma won't tell you, maybe your great aunt will, or maybe your cousin, your first cousin, knows something. You don't want really guesses, but you want to know what people knew and what was actual information. I'm going to stop there today. I do want to say, I think there's some polls. I did a couple of polls, and I'm not sure where they might show up, but if you would let me know if this kind of information is helpful, say yes, this is helpful, or no, this is not helpful. And if you would tell me other things that you would like to know about, like are there types of research? Do you want to know about advocating, which is we'll talk about more? Do you need more information about caregiving, or paperwork for caregiving? This was kind of the beginning of paperwork for caregiving, and we'll talk a little bit more about some other documents that you might need to have, especially family documents that you might need to have if you're taking care of an elder, if you're taking care of a family friend, if you're taking care of other family members. there are pieces of paperwork that you need to know, sometimes just so that you can talk to the doctors on their behalf. And if somebody is going through something, they don't always have the presence of mind to ask the questions that you think about. So we'll talk a little bit more about that on a later date. My goal Thursday at noon will be to talk about what kinds of things to expect at the doctor's office and the hospital or the ER, and how best to deal with people that you encounter there. Sometimes everything goes smoothly, and that's a wonderful thing. And sometimes things don't go so well. And if you're advocating for someone, there are some things, some steps that might be helpful for you. And I think I've already placed a file in the file section that is a letter that I used to address some issues at the emergency room and the hospital on one of my last visits there. I find that if you talk softly and speak your concerns instead of screaming and yelling, things get handled for you a little bit better. And especially if you are going to have to go back to the same hospital or are in the same area, you don't want a bad reputation to precede you or to follow you. You want to make sure that the things that you need to have taken care of for your person or for yourself are done. But sometimes when we scream and yell and we're in pain, and I get that, things don't go as well for us. So if you are watching this and you weren't on the live, please type hashtag replay in the comment section. And if there are any questions, if you have questions or concerns or other comments, either put them in the comment section or feel free to write a post or ask something in Taking Care of Us. Also, feel free to invite your friends and family members to join in. We would love to be of assistance to them. And I will look forward to seeing you this coming Thursday at noon. Thanks so much. Take care. Take care of yourself. Bye-bye.